For our job analysis, we will be analyzing a bartender who recently had a botchar's fracture. And before we begin, we will describe what a botchar's fracture is, the etiology, some symptoms, treatments, the OT profile, and the case study associated with our patient. So a botchar's fracture typically occurs within the fourth and the fifth digits of the hand.
The displacements and comminution varies depending on the force of the injury. So the force usually travels from the head of the metacarpal to the base.
Okay, and then so the etiology of the botchar's fracture is commonly caused by hitting an object with a closed fist. So things like getting into a fist fight or hitting an immovable object such as a cabinet or a wall. And although this can be caused by hitting something with a closed fist, it also can occur by hitting something with an open fist. Some of the symptoms associated with a botchar's fracture, the patient may experience snapping or a popping sensation. They may experience swelling, discoloration, or bruising. They may also have a cut on the hand and a misalignment of the fingers. And if the patient has a misalignment of the fingers and a cut on the hand, that is an indication that the botchar's fracture is more severe.
So to diagnose a botchar's fracture, a client will have to see a physician who will conduct a physical exam and may need an x-ray to confirm the diagnosis. Treatment is going to depend on the severity of the fracture. So if the botchar's fracture is more severe, the person might need to undergo surgery such as ORIF. If it's less severe, the physician will probably recommend immobilization of the joints using a splint to allow the injury time to heal. So for our case study, we have Justin, who after getting into a heated argument with his brother last Tuesday, punched the wall. A few hours later, Justin noticed redness and swelling close to the knuckles around his fourth and fifth digit of his dominant hand. Justin went to the ER on Wednesday night after noticing his symptoms were still present. Through the use of an x-ray, it was determined that Justin suffered a boxer's fracture. Justin's fracture was not severe enough to warrant a surgical approach. However, the physician recommended the use of a splint to immobilize the joints. Justin was cleared to return back to work as a bartender, but upon the first day of returning, he noticed increasing pain while mixing drinks using a shaker and had difficulty gripping the Mueller. The physician then recommended that the occupational therapist perform a job analysis that will provide techniques to allow Justin to successfully continue working safely. So, as the OT students, we created an OT profile in which we stated that Justin is a 23-year-old male with a diagnosis of boxer's fracture on the fourth and fifth digits of the right hand. Justin's dominant extremity is the right hand, and Justin is seeking services to increase functional performance in his AEDLs, IADLs, work, and education. Justin is a graduate student at Howard University and works as a bartender 4 days a week at a restaurant. Justin lives on the fifth floor of the apartment with one roommate. He also enjoys meeting new people, cooking, going to museums, and spending time with friends. Justin presents with decreased grip strength and difficulty holding objects. He also shows decreased range of motion in the fourth and fifth digits, and his primary goal is to decrease pain and return to work. So now we'll be going to Justin's job to analyze his workspace so that we are able to provide modifications and techniques to ensure Justin is able to complete his job safely and efficiently.
Now we'll show an example of the activity demands preparing and making a cocktail. Here he is cutting below correct height, so that's exerting postural stress. And as he continues to prepare for making a cocktail, this is another example of repetition stress or static exertions as he is holding on to that handle. He has to hold it on tight. And this next scene is an example of forceful exertions as he uses a manual juicer to get the juice out of the lemon. Once again, putting repeated stress and force on that affected hand. In the next scene, he is seen using the shaker cup with one hand to mix the cocktail. For this job analysis, we would suggest that he cuts at a higher height to reduce postural stress, a built-up handle. We would suggest a machine juicer to extract the juices without exerting too much force. And we would suggest that he uses both hands when using the shaking method to reduce stress on that affected hand.